Good evening, cat lovers and cat parents and veterinarians. So today we are up for a very important discussion. So we have a power pack panel where we are going to discuss about feline infectious diseases. How dreadful they are and how somebody can prevent them and what are the precautions one needs to take. So we are going to touch a lot of aspects in regards to that. So going ahead, I would just like to bring in one by one our panelists so that I can basically introduce them, and they'll be somebody who we are going to listen for next 45 minutes or 1 hour. So Dr. Anisha. Hello ma'am, good evening.
Hi, good evening, Sakir.
So Dr. Anisha Tiwari is from Jammu. She is, along with her husband, is running a multi-specialty veterinary clinic called as Suvidha Vet Care and a research center. And they have 2 more branches in Jammu and Kashmir with an experience of 8 years in small animal dermatology with almost 50% feline patients OPD. She established her own dermatology clinic in 2016, Suvidha Pet Care and Derma Center, completely dedicated to dermatological cases and having facilities like in-house fungal culture, cytology detection with complete in-house lab. Being graduate from vet parasitology and having keen interest in small animal dermatology, he has been trained under European schools of advanced veterinary studies in dermatology by one of the world's best dermatologists, Professor David Lloyd and Professor Craig Griffin. She has attended courses in different parts of the world, including Southeast Asia, Vienna, Liverpool. She has actively attended various national and international conferences. She is the first Indian veterinarian to be conferred with scholarship for continuing education in dermatology from United Kingdom, Japan, and Australia. In recognition to her outstanding contribution, the Association of Animal Scientists and conferred her Entrepreneur Award in the field of veterinary on 6th March 2020 at First Veterinary and Small Animal Congress held at College of Veterinary Science and Animal Husbandry, Mahur, which is in Madhya Pradesh. She has been invited as lead speaker in College of Veterinary Science and KH on dermatology. She is a member of ESVD, also AISVD and IAVD. So it's a pleasure to have you, Dr. Anisha.
Thank you so much. Thank you.
It's always great to listen to your insights. So I'll just come back to you, and I think one part that is not mentioned is that you also have a cat only clinic in Jammu.
That is the cat salon clinic I have.
Yes. The cat salon clinic. So I think that's something that you missed in your bio, but I would like to tell everybody. So great, ma'am. So we'll just introduce Dr. Amrita. So Dr. Amrita Dev, good evening.
Good evening, Sakir.
Dr. Amrita Dev is a veterinarian and proprietor of Wild West Veterinary Clinic, Mumbai, a small and exotic animal practice in Bandra. She graduated in 2003 from Bombay Veterinary College as gold medalist and went on to pursue a master's degree in veterinary surgery at the same college. In 2004, she left India to pursue from the University of Reading, UK, on a full scholarship. Thereafter, she moved to Qatar and worked for next 3 years as veterinarian and head of conservation at Al Wabra Wildlife Preservation, a private breeding center for endangered species, including the now extinct Sphinx macaw. She spent the next year in the UK qualifying for the examination on becoming the member of the Royal College of Veterinary Surgeons, United Kingdom. Thereafter, Dr. Amrita worked on the state-of-art Sau Wafi Falcon Hospital in Qatar, mixed small animal practice and exotic consultancy for 5 years before moving back to India. In 2015, to start Wild Vets, Dr. Amrita has more than 35 papers and presentations in international journals and conferences, respectively, to her credit. So, fantastic, ma'am, as you have your hands on not only small animals that we have, like cats and dogs, but you have your work in birds as well as exotics. And for them, also, diagnosis is very important when it comes to feline infectious diseases. So, I think we'll have a broader insight today about what we are going to talk about for the infectious diseases.
Absolutely. Thank you, Sakir.
Thank you, ma'am. Next we have is Dr. Pratik Pawar. He is the technical and marketing manager for India, Sri Lanka, Bangladesh and Nepal for the brand Zoetis. So Dr. Pratik Pawar has done his graduation in veterinary science of Bombay Veterinary College. Further, he pursued veterinary master's degree in animal biotechnology from Bombay Veterinary College. He also has a diploma in clinical research from ACE, Bombay College of Pharmacy. He has been into small and the exotic animal practice for around 5 years before moving to South Korea to work on Salmonella ghost vaccine project on poultry birds. After that, he joined BBPL Hyderabad in research and development, working on large and small animal, viral and bacterial vaccine projects. Then he joined Zoetis India Private Limited, currently looking after the technical and marketing, which I already discussed. He's the technical marketing marketer or manager. He has been associated with several research papers, also studies in Wasawa, in numerous countries. He has also been part of several camps and workshops and have been associated with various NGOs working on stray animals and injured birds and reptiles. So, good evening, sir.
Thank you, Sakib. Good evening.
Good evening, sir. So, we would love to have a lot of insight from the horse's mouth. You are the people known to produce one of the world-class vaccines for infectious diseases. So I think it would be so exciting to talk to all of you. So
Yes.
I'll
Thank
catch
you,
you.
Ma. Yeah.
Next we have is Professor Utpal Tatu. So good evening, sir. So your mic is on mute.
Yes, good evening, Sakib. Good evening.
Good evening, sir. So to talk about Professor Utpal Tatu, a lot of people have heard him talking in our conventions, and I think he has been on almost every convention that FCI has hosted from 2017. So Professor Tatu is a celebrated professor at Indian Institute of Science, obtained his PhD from the same. He pursues his postdoctoral research at Yale School of Medicine, New Haven, and went to become an assistant professor there. His most notable research delves into neglected infectious diseases such as amoebiasis, babesiosis, and candidiasis, malaria, rabies, toxoplasmosis, and trypanosomosis. With all this, he aims to develop medicines and drugs to make them widely affordable. With over 2 decades of experience in global health, he continues to implement his research expertise to improve animal health and social entrepreneurial initiative, Pet Biotech. The initiative, powered by Indian Institute of Science and headed by him as a director, aims to improve the develop diagnostic and therapeutic approach for our beloved pets. In association with many top pets in India, his lab is capable of testing numerous canine, feline, and avian diseases, and also equine, if I'm not missing it. He has also received numerous accolades: Birla Science Prize, Bioscience Career Development Award from DBT, and Ranbaxy Research Award, to name a few. He is an elected fellow on Indian Academy of Science. He was formerly the president of both Proteomimetic Society of India and vice president of Indian Society of Mass Spectrometry. He's also on the editorial board of the Parasitol journal published by the Cambridge Press. Given his experience, from Professor Tatu's reputation is not limited only nationwide, but he is a research advisory boards of several biotech companies in India. And if I'm not missing something that which is important, he's also on board of a lot of government agencies and societies as their somebody who the government looks up to in terms of COVID. They also developed an RT-PCR, which was, I think, one of the India's first in-house developed RT-PCR that he made. And having said that, he's also the one who spearheads the scientific research and development for Feline Club of India. We are doing a lot of anatomical, morphological, DNA testing, gene pool, and all sort of studies with Professor Utpal Tatu under his guidance. So, good evening, sir.
Good evening, Sakib. Thank you for your kind introduction. Thank you.
Thank you, sir. So I would like to have all of you together, and then let's start with. So, Professor Tatu, your study especially is into the infectious diseases, and that's your area of interest. So, how would you like to address that? How things are in feline at the moment, and what is the future and scope about the viruses and its treatment?
Yes, thank you, Sakib. Thanks for asking that very pertinent question. And first of all, let me also, it's such an honor to be amongst this august panel. All the colleagues who are from different parts of the country, who are so highly acclaimed veterinary doctors and doing such a wonderful job. Thank you for having me on the panel, FCI and Sakib personally. Yeah, I think feline infections are something that we've been talking about for a long time. I think felines, on the one hand, are relatively robust and refractile. I think they have the tendency to resist problems. But in terms of infectious diseases, they do have susceptibilities that we must look after. And first thing that I want to actually tell the audience here is that really, I think these are very handleable problems. If you take some basic care, feline are very easy to keep healthy and safe. I will share with you and with my colleagues today this evening some care and some sort of precautions that we must take. But very quickly, I want to just say that one of the problems in cats, as much as we love them, is that they are very generous animals and they tend to hide their problems. And this is one problem that we actually encounter in handling even infectious diseases. Cats exhibit symptoms always at a late stage because they have a tendency to, as I already said, hide. For example, pain. They don't like to exhibit pain. And these are some of the issues that we have peculiar to feline that we really need to watch out and observe them very closely. And along with that, I may want to add that to be able to handle potential infections in cats, we should also do recurrent veterinary visits for the reason that I think you may miss initial early signs that are oftentimes obvious in other animals, but in cats, for the reason that I mentioned, they may mask it for the pride that they have in themselves, and that's really why close monitoring is the key. Recurrent visits to the vet and preventive testing, if I may say so, I think are the key. And the specific problems about cats, we all are somewhat aware of, but there are about 8 to 10 common problems, common infections, which we will talk about as the discussion progresses, Sakib. So this is my introductory, sort of just a little bit of my 2 pence on this topic for the time being, Sakib.
Thank you, Professor Tatu, because we have two excellent practicing vets with us, Dr. Anisha and Dr. Amrita, and they would also agree to this fact that cats hide their problem. And globally, in diagnosis of cats, it's a huge issue, and it's supposed to be one of the most challenging animals to deal with because nature is how they have this evolutionary psychology that they will hide their pain, and it becomes very tedious even for cat owners who are seeing them day in day out to notice that there is some change in their behavior. And when they come down to the doctors, they are mostly in the irreversible stage. So doctors have very less to do. So that's an excellent input, that regular checkups and preventive tests that one should do. So we'll go ahead and now my next question to Dr. Amrita Dev will be that FIP and FIV are the most dreaded infection in cats. So what are your views on that? As I talk about how it can be prevented and how fatal damage that they can create on your cats.
Okay, so that's a whole big can of worms there. I'd like to start off by touching a little bit on what Professor Tatu said, which is that A, cats are mysterious. B, as an urban population in Mumbai, we are seeing such a growing population of cats as pet cats, that it is our duty as veterinarians, and this is worldwide. Feline medicine is a growing science, to make our environments in the clinic more cat friendly, to understand our cat patients better, to try and do better for them. 10 years ago, I remember the buzzword was cats are not small dogs. That's when people started realizing, oh my God, these are, they're completely different beings. They have different needs, different physiology, different array of behaviors. And it's really opened up a fantastic science for us. Okay. Of course, we are vaccinating for cats today, but we are vaccinating for a very small number of diseases as compared to what cats can suffer from. Okay. And of course, two fantastic examples are the ones you've mentioned right now, Sakib, which is FIV and FIP. I'll start with, I think, FIP, because this is something everyone really dreads. I mean, people come into the clinic and say, oh, you know what, my cat's been sick for 3 months. I'm sure it has FIP. Can you do something? So it is really, this is feline infectious peritonitis. That is the full form of FIP. Strangely, it's not a completely understood disease. As of this year, we are still struggling with treatments. Okay. And there is something new that has come up that I will discuss at the end, but let's just introduce FIP. So FIP is basically caused by, very quickly, by a coronavirus, and which has nothing to do with COVID actually, which is again another very big fear that pet parents have.
Yeah.
This is an enteric coronavirus which has been around for ages. It causes diarrhea. So enteric means gastrointestinal. It causes self-limiting diarrhea, gastrointestinal signs, very rarely some upper respiratory signs, but we don't really see this. It has a very, very high prevalence, much less than we are detecting or that we know. So they estimate that almost 50% of cats are exposed to this coronavirus. Okay, this is not FIP, this is a coronavirus. Okay, up to 75% if you're in a shelter or a cattery environment. And then in 10%, so 90% will have a diarrhea, finish, little bit of, maybe nose watering, eye watering, little fever, and it's done. Okay, the cat is fine after that. But in 10% of the cases, and whether this is because of individual factors, host immunity, obviously there's multiple things at play here. The viral load, much like COVID, much like malaria, in fact, the parasite load that you're exposed to, that the cat is exposed to, it mutates a little bit and forms the FIP virus, okay, which is the feline infectious peritonitis. These cats get really sick. There are two forms. One of the classic signs is this cat will have fever that does not respond to medication. It will lose appetite. And this will be ongoing. FIP is not a very acute. It can be acute, but that's often because it's detected very late. This cat has been hiding it in the dry. There's a dry form and a wet form. So the wet form is the more commonly known form, where, the belly fills up with fluid. Sometimes the cat is gasping because the chest cavity fills up with fluid. And it's a very dramatic thing. This cat is very sick, not eating, febrile. And often at that point is when we have some chance of diagnosing it. Some chance, not 100%. Okay. But there's also a dry form, which is a little more elusive. So these cats don't do well. And so there's no wet, there's no fluid buildup anywhere, but they do lose weight, they don't eat. Sometimes they have eye lesions. Sometimes these then progress to nervous signs. So you'll see, them becoming wobbly, getting paralyzed, getting seizures sometimes. There's such a wide array because what it does is it affects the macrophages, which are part of the immune system. Okay. And then once it replicates, it will go and spread to different parts of the body and cause different signs. Okay. So this is what FIP really is. And diagnostically, even today, for us, it is a challenge. What are the things we look for? Am I taking too much time, Saqib? Should I be quicker on this?
No. It's something which is integrated. It's not only for the doctors, I would say, but even for cat owners, it's because you know that your cat is going to die, and you absolutely can't do anything. And a lot of people do not go for, they do not go ahead and euthanize the cat, and it's complete, the whole thing for a cat. It's a nightmare. It's something that the enemy should not get. So
I know.
Please.
Okay, so there are a couple of things that work together when we try and diagnose it. Okay, one is definitely the signalment. There seems to be some factors which predispose certain cats. And again, these factors are not very well understood. One is they're usually either very young cats or very old cats. So usually less than 1.5 years, or old cats whose immunity is less. Okay. They tend to be more often males than females, and we don't know why. Okay. We don't know whether it's because the males are roaming more once they're sexually mature, what it is. Definitely in a cattery or a shelter or a multi-cat environment, you get more FIP. Okay. Kittens can get FIP from the mother also. So it's not exclusively that, they will get it from other cats only. It is very contagious, but it is also easily sort of cleaned by disinfection. So FIP is not like parvovirus, which, persists in the environment for 6 months. Normal disinfectants can get rid of FIP quite easily. Okay. And so this is the signalment. You will have typically a male young cat coming in who's been sick, had 3 rounds, 4 rounds of antibiotic, still has fever, still very dull, maybe eating a little bit. Sometimes they continue to actually eat a little bit, not so well, but they continue to eat a little bit almost till the end, And then, of course, they can have
They will suddenly
Yeah,
collapse for a day
yes,
and
exactly.
they will
With a
not eat,
big
and then
belly. Yeah,
with the big belly.
yeah. So in the blood work, we do see some changes. Typically, what we see is a hyperglobulinemia, which is a very high globulin count. It's very important when your cats are sick. Do the blood work. This is more important than for dogs. As Professor Tatu said, our clinical examination, because of how cats are, because of how sometimes they are difficult to handle. They have 5 mouths, they have 4 feet and one mouth, so they're not always really accustomed to close contact with humans. Like, we have people who feed 20, 25, 30 cats. Each of them they take responsibility for, but it doesn't mean that the cat is accustomed to humans handling this cat, right? And then you'll get the hyperglobulinemia. You will get some effusions. Maybe if you do have the effusion, we take a sample of this effusion. So this is the water that fills up in the belly, the fluid that fills up in the belly or the chest. We take a sample. It will be high in protein. It will be clear, yellow, sticky. We do something which is an in-house test called a Rivalta test, which is, I think, something that all vet clinics can do in-house. This will not diagnose FIP, but it will tell you, look, again, likelihood. If your cat is meeting all these tick boxes, then there is an increased likelihood of FIP. And of course, finally, what Professor Tatu does is the PCR. There is a PCR. It doesn't always detect the FIP. But if it does, then and the cat is showing signs and it meets all the criteria, then there is a high likelihood that it is FIP. Okay. The light at the end of the tunnel this year, actually, before it's not all doom, is that there was a study published in Sydney. All this time there has been a drug on the black market. It's not been approved by the FDA. It's called GS, some random series of numbers, 544 something. I keep forgetting the numbers. But people have used it, and to good effect. Okay. But however, it's very, very difficult to get. Some people get it off the black market, and it's very, very expensive. But recently, a similar prodrug, an antiviral drug, which has been very commonly used for COVID, is called remdesivir. Okay. And that has been published by a team in the University of Sydney, where they have used it. They have just started using it. These are very initial trials. And apparently they have been successful in treating almost more than 100 cats. So there's a little bit of promise. It's still a long road. Obviously, it depends on what stage you're catching the disease and the immunity of the cat. But yeah, that's what FIP is. This is pretty much what FIP is about. Okay.
Thank you, ma'am, for your explanation and elaborate explanation. And you have so many questions on FIP, and I'll just keep these questions open-ended. Yes. Anybody can come and take, because we as an organization, we get so many inquiries about FIP, and we do lead them to consult vets in that particular city. But at certain point of time, we both are helpless, the cat owners as well as vets, when it comes to FIP. But fortunately, the question to you is, ma'am, that if a cat gets cured, luckily with all these drugs that you're talking about, so a lot of people recommend that your cats should be neutered, okay, after they have been recovered from FIP, and they should not be recovered immediately, because they should be on prebiotics and probiotics for a very long time, because immunity plays a very important role for conversion from corona to FIP, is what a lot of people say. So is it true that your cat should be neutered after getting recovered from FIP, and they should not be bred because genetically they will carry corona?
Yes, they can continue to carry. There is a risk, definitely, and I do think that once your cat is well, the problem is there is such a small subset of cats who have recovered that thereafter long-term studies. So this is almost 12 weeks of treatment, plus you're going to give them some time before they're actually fit and absolutely normal before you take them into surgery. Yeah, so it would be a long story, but we still have to reach the place where we have those cats who are recovered before we try and get them into surgery. Yes, but it would be a good idea. I think it's a good idea, definitely, not to ever breed those cats. They must be isolated anyway. Okay.
Right. And also, my question, I think if Dr. Anisha or Dr. Pratik can help me out with this question, is like, when a cat, it's you have FIP, and with your PCR or your vet is pretty sure that your cat is FIP. So do you need to isolate that cat because the feces can spread FIP from one cat to another. Although there is also a debate on this thing that once FIP is done, once it has been mutated to FIP, there is no transmission. Okay, the transmission would be from corona to corona, but FIP does not transmit. So just to add on to this, just to clear this air, what would you have your insight on this particular thing? That as a cat owner, what should they do if their cat is diagnosed with FIP? Because why I'm asking you this question is isolation will bring in a lot of trauma to your cat, which is already sick. Okay, so unlike dogs, the stress level management is very important in cats. So once you are isolating the cat, which is already with FIP, so you are literally 20% or 20% or 30% adding on to the problem because it will be very stressful for that cat. So what is the right practice that one should do in treating this cats with FIP?
Well,
Yeah, please, ma'am.
to be very frank, Sakib, FIP is the most dreaded infection, as we all
Right.
know, because it is
Yes.
very contagious. It can transmit from one cat to another. If one cat is positive for FIP, that
Mm-hmm.
surrounding cats definitely they are positive for coronavirus.
Okay.
Okay. So if FIP positive case is there, you have to tell the client that we have to euthanize your cat. Otherwise, there is no option. Yes, we can initiate a short-term, therapy for that, but it decreases the quality of life. We cannot
Right.
enhance the quality of life because FIP or FIV, both are these infections. Death is essential for these infections. Death is the only things. Okay.
So your recommendation is we should isolate them.
We should isolate them. Even if IP cat is there and we have euthanized, tell the client you have to wait for 3 months at least. Disinfection, you can initiate the procedure of disinfection and all that. Then only bring a new cat to your home. FIP cat should be isolated from other cats because it can transmit to any cat very rapidly, very contagious.
Right. So that should be the thing that if you have a cat with FIP and you're trying to work on it and you're not going ahead with euthanizing, you mean to say that you should isolate the cat for sure.
Yes.
Dr. Pratik, Professor Utpal, your insight on this?
Yes, Sakib. So, see, the general rules with any infectious disease is basically if you have a pet who is infectious, so the first step is to isolate. If you have a house which has multiple cats or multiple animals, so because you don't want to spread the infection to other cats. Yes, I understand that cats are sensitive; they would have a stress level, but you need to actually weigh out the risk for the other cats also. So, with it's not only true with FIP; it is true with any infectious disease that once you have an infected cat, you need to isolate the cat and keep the other cats protected from the infected cat. Another rule would be when you're handling your day-to-day activities, so you need to cater to the healthy cats first, then to the infection, because you don't want to spread the infection from the infected cat to the healthy cats. It should not be. Yeah, so that is one of the I think should be a thumb rule kind of a thing where needs to be practiced with any infectious diseases.
Exactly. That's a very important point, Dr. Pratik, and I think that's something that everybody should do. That if you're cleaning your litter tray or maybe feeding or cleaning the water bowl, go to the quarantined area at the last. Don't go there first and then come to the healthy cats. So that's a very important insight. Professor Tatu, anything you would like to add on
Yes,
FIP?
Sakib, I think already a lot has been said about, I think, wonderful narration and, important remarks by Dr. Amrita and then followed by Dr. Anisha and Dr. Pratik actually concurred. And so the only thing that remains to be said, I think, is that it's very important to test. One sort of a misconception of a FIP is 100% fatality. I think that's changing slowly.
Right.
I we test for hundreds of FIP, potentially FIP cases every month. So that's one of the most tested diseases in India at the moment, and we are testing from all over India. And FIP is one of the most commonly asked for tests. And I'll tell you that even in those cats where it has turned positive, there are cases where the cats have survived. This is the realistic information that I want to share with the audience. So do not give up. I think,
Don't lose hope.
I think there is. Sorry, Sakib, you were saying something.
I said, don't lose hope.
Don't lose hope, because we yet, as Dr. Amrita said, we don't know enough about FIP yet. There's an ongoing research on this topic world over, including my own lab. The mutations that Dr. Amrita mentioned are now well characterized, and we are able to differentiate between dry and the, the exudate forming
Right.
FIP. Because of the mutations, we are actually able to tell which FIP it is based on the viral gene sequences. So what I'm saying is that science is evolving, and wonderful good news that Dr. Amrita shared is that remdesivir seems to have some promise. So we are all actually looking very, hopeful about this case. But what I would like to suggest is that testing is important for the reason that oftentimes the symptoms get mistaken. And what people do is, we start treatments which are not necessary oftentimes. So if you already know that this is FIP positive, you wouldn't do, treatments that are probably not required at that point for that cat. And then possibly if you have access to the drugs that Dr. Amrita mentioned, that would actually be a wonderful possibility for you. But yes, and I fully concur that isolation may be a good idea. And as Dr. Pratik emphasized, this is generally true. Infectious, contagious diseases, you really have to kind of take some care. As much as the cats don't like it, but I think we really need to make sure that the other cats don't get the infection. So yes, 2 points. I think I'll summarize by saying that get to know whether it's really FIP. If your veterinary doctor suspects that your cat has FIP, do get it confirmed. And PCR is the world standard, gold standard, which I think works. And it is it can miss, as again Dr. Amrita mentioned. Sometimes it can miss, and that's because of the low viral load at some stage of the disease. But so that's really what I'd like to end by saying, that I think find out precisely if it's FIP, and then take appropriate measures and be hopeful, as Sakib mentioned, that there's always hope, and it's not the end of the road. So that's really my take on this very important
Thank you
disease.
to all four of you, for summarizing it so beautifully. And there were few important points that we all discussed. Again, Dr. Amrita, Dr. Dhananjay Pandit would like to ask you a question. He says that it's which form of FIP is more prevalent, dry or wet in Mumbai?
It's a good question. I would say we are seeing the wet form more, but maybe we are just diagnosing it more because it's easier to diagnose. The dry form might be getting missed. Sometimes when I'm doing ultrasounds for other things, I notice some pyogranulomas in the kidneys, which I think, could this cat have had, FCOV? Or, I'm not sure, but I definitely think the wet form is more common. We see a lot of the wet. We see it in kittens. We see it in older male cats. We see it quite a lot. We see a lot of it, unfortunately. Yeah.
Ma'am, one good thing you also mentioned that when you do the blood work, you get a lot of roadmap. Like specifically in FIP, your neutrophils will shoot down. There will be shoot up. There will be change in albumin and protein level significantly, and then you can go for PCR and do it. You can confirm. So then this is a request to all the cat owners that whenever you are having some sort of issues, don't hesitate to get the blood work done. Because cats, as you said, they have 5 mouths or 5 attack points. It's very difficult for them also, and they are hesitant that their cats will be in stress because going to a doctor is never easy to get the blood out of your cat. It's a big mess and drama that cat will do to get the blood out. But once you do the blood work, you get the roadmap, and then you can precisely confirm with the privileges that Pet Biotech provides us nowadays. We can do the PCR and make sure that it's 100% FIP, and then if your diagnosis is complete, you can be very keen on the medication part and try and be hopeful. So, is it something that is something that can help us to get to know more about the dry form of FIP?
Are you asking me, Sakib?
To you.
Okay. One more thing that very quickly I'd like to say in summary to our whole, discussion on isolation of cats. Okay. If I have 5 cats, I just want to say, and I have one FIP cat, the other 4 cats may not get FIP, but they will get the coronavirus, which anyway I want to prevent. The second thing is that along with FIP, we usually get toxoplasma, something else, sometimes FIV. We may not be testing for everything. So in general, what Dr. Anisha said, what Dr. Pratik said, and and Professor Tatu said is, look, the FIP cat is a very sick cat. There are multiple things going on. Till you figured it out, till it is well enough, it's just wise to. But it doesn't mean all your cats are going to get FIP. That's not something that may happen, that needs to happen all the time. So dry FIP, and again, dry FIP will show you the blood work that is, the signalment is the same. So it will be young cats or very old cats. It will be more common in multi-cat. It will be febrile. So there will be fever. If you have a cat who's well and not eating, look for something else. Look for pancreatitis. Look for anything else, but liver problems, whatever. But if you have a cat who has fever, who's gone through 2-3 courses of antibiotics, not responding, go ahead, do that blood test, do those x-rays, see if you can diagnose something with imaging. Do the PCR if you need to. That we do it. In fact, we have more and more people coming forward and saying, my cat, they're all rescued, all 3 of them. They have chronic eye problems. Can you just run the whole PCR panel for them? And Professor Tatu does a PCR panel which tests for 6 or 7 infectious diseases, and I think that this is something that we will see growing. It will happen more and more and more, and we will see it happening more often. Having said that, if I have a well cat and I find a coronavirus or a FIP, I don't want to do anything about it, because unless I have clinical signs and an unwell cat, it might be something that's passing through the cat system and therefore should not be taken as my cat is sick and has FIP and is going to die tomorrow.
Right. Yeah. We need to confirm clinically, scientifically, to make sure that it is an FIP. Dr. Anisha, would you like to say something about FIP? Because that will be the second most dreaded disease when you talk about infectious diseases. So, what is your take on FIP?
See, Sakib, I'm always feel helpless when these cases are presented to my clinic, because I have to say to the client like, yeah, your cat are really going to die, and we have to do something. So when these cats came to positive for FIP and FIV, to be very frank, they are going to die. We are trying to save these cats, but we have to convince the owner. We have to tell whole story about these dramatic or very dreadful diseases about the from to the client, that these diseases are really dreadful and you have to be very careful about it. If you have 5 or 6 cats, you need to be take all the precautions or all the preventions for other cats too.
Okay, ma'am. And we just touched onto toxoplasmosis, Dr. Amrita.
Sakib, just wanted to, I think before you switch the topic, I just wanted to a quick comment on another
FIV.
additional point that I think continuation of what Dr. Amrita was talking about and Dr. Anisha mentioned also, the dry and the wet form, oftentimes I think the wet form is easier to diagnose because people often, not in the blood, but it's the exudate that is necessary to be sent to the lab. And that's
Yeah.
something I want to emphasize. That's the best way to confirm FIP infection if you have. And another additional point, I think, which of course my veterinary colleagues will appreciate much more than me, but I just want to bring it out, is that there could be other infections which could result in swelling of the belly and exudate formation. So having exudate formation doesn't always mean FIP, and that's something that that's something you don't need to really panic, because there could be simpler infections that may cause similar sort of bloating up of the belly. That I wanted to leave behind. And over to you, Sakib. Thank you, and thanks for sorry for interrupting.
No. It's thank you for your insight, Professor Tatu. And I would jointly like to ask a question to Dr. Pratik and to you, Professor Tatu, is about toxoplasmosis. So, Dr. Pratik, you can tell about what toxoplasmosis does into cats, and then Professor Tatu, you can give us an insight about the zoonotic importance of toxoplasmosis. So, Dr. Pratik, if you would like to go first.
Yeah, thanks, Sakib. So, as we know that toxoplasmosis is caused by it's caused by single cellular organism, but the root actually is to the feces. Normally, many of the time it may not show symptoms. So usually the like people do get infected over there. For a general people, it is not very much of concern, but to those individuals who have a weakened immunity and to those who are pregnant and all. So it is more concern in those population basically. And what we have also seen is that if you have known people who have a weakened immunity and you have a pregnant lady in the house, it is also advisable that they should not actually handle the litter box, and even because it is passed through the feces. So there is no a specific signs that it will be very specific that the cat is having toxoplasmosis. Even in normal individual, it will not have any symptoms. But as a precautionary measure, you have to take some precaution in that one. So in general public, they don't cause any maybe specific signs only in the individuals which have weakened immunity. Yeah.
Professor Tatu?
Right, right. I think another enigmatic disease that you brought up here, toxoplasmosis, and so little is known. And even though the disease is so well known and it exists for a long time, typically they're in cats, but its potential of zoonosis is there, as you already emphasized, and Dr. Pratik threw some light on it. In my own research laboratory, we do a full-fledged research program on toxoplasmosis for the reason that it's really enigmatic in the sense that we don't understand what are the things it does in the cat and in the human body. We still don't fully understand not only the mechanisms but also the outcomes of the infection. And I think many things about toxo are commonly talked about, but I just want to emphasize here that one of the things unique to toxo is that it can also cause neurological symptoms. And that's something highly researched upon. That what does it do to your brain circuitries? How does it do it? These are the questions we are asking. But for the cat owners, I think I would just want to take it forward from Dr. Pratik that important to be careful for pregnant women. They are particularly susceptible for transmission from cat litter and so on. Tests are readily available, of course. There are numerous tests, including molecular tests that are easily accessible to people today. So easy to confirm. It's also possible to treat it. So that's something that I'll leave it for my veterinary colleagues to talk about later. But I think it's pattern, and this is something I want to also pass on the message that what we read as students, as veterinary students, or as researchers in our textbooks are important facts, but those facts are changing. And that's really also the case with two important diseases that we talked about, FIP. And I think these are so rapidly evolving infections. And so we have to keep up understanding what's new. How is it exhibiting itself in animals? And then, of course, the newly developed methodologies to diagnose it, be it through imaging or through molecular methods such as PCR. That's really what is rapidly changing, and all my capable colleagues today at the platform actually are sort of some of the leaders pioneered, I think, keeping up with the new technologies. So I'm very glad that this thought process is set in the veterinary. The big problem, I mean, I'll just end very quickly with this sentence because I'm very passionate about especially toxoplasmosis. So I'm sorry I'm taking a little bit longer. Just want to leave you with the fact that traditionally we haven't paid enough attention to this. Not only we haven't paid attention to diagnosis but also to treatments. And now suddenly the awareness is crept in, not only for toxo and FIP, for many other infections. And that's why combination of a veterinary diagnostic and then a molecular method is something that's going to be the cornerstone of keeping your cat healthy and also, of course, being healthy ourselves. Yeah, I think I'll pass it on back to you, Sakib. If there's any further, somebody else want to say something on this.
No, that's a fantastic input. And as you said, that we know very little about toxoplasmosis as FIP. It's again it has a certain zoonotic importance. So I wanted to give emphasis on toxoplasmosis. Going ahead, I would like to ask Dr. Anisha and Dr. Amrita, because they are practicing vets, that what are the other popular infectious diseases that we see in our country,
Yeah.
other than toxo, FIP, and FIP, FIV and FIP. So, Dr. Amrita, would you like to go first?
Yeah, so with just with respect to toxoplasmosis also, the times when we really suspect it in a cat is number one when we see a hepatopathy in a kitten, like an enlarged liver with diarrhea, or when we see typically a cat who's circling. Yeah, this is one of the two times when we say, okay, toxoplasma is definitely a differential here. I think the most, I would say in my clinic, the most common infectious disease in cats that we see is our cat flu syndrome, or the upper respiratory, ocular nasal discharge. Fortunately or unfortunately, almost all of our pet cats, at least 80% of them, 20% are from people who have bred at home, or breeders, or whatever it is, they've gone and bought a cat. But almost 80% of them are people who've picked up a kitten off the road. And almost 90% of those will come in with sneezing, eye discharge, hoarse, can't meow, no voices coming out, sometimes fever. So this would, I think, it might be different where Dr. Anisha is practicing in Jammu, but in Mumbai, this is so common. It's almost like a rite of passage for kittens to go through. I'm sure it gives them some amount of immunity as well. So the herpes virus, Kalisi virus, I don't know if chlamydia is involved, possibly it is, sometimes bordetella. This is definitely the most common syndrome we are seeing. We are also seeing, so with infectious diseases, we cover so many things. So we see definitely diarrhea, we see parvovirus, the feline parvovirus, which is also pretty horrifying. It is definitely treatable, it needs to be caught early. We are testing for it. So that is something that I think awareness needs to be out there, that if your cat is vomiting and has diarrhea and it has especially blood in it, please get it to the vet, get it tested. And I mean, then it needs to be on heavy treatment and fluids, but they do respond. At least 70% of them do respond, okay, depending on what age they get this parvovirus. With other things, I think, I mean, there's mange and things like that, but that's scabies, mange. So the skin infections, which are also infectious diseases, we see quite a lot of that. But I think massively with the cats, and this is where our struggle really is we see a lot of, I mean, non-infectious conditions as well, but in infections, I think there's just such a wide range. We see something called a blood parasite, which is Mycoplasma haemophilus, which is like a kind of like a flea tick fever in cats. And I think these are parvovirus, upper respiratory tract infections, other diarrheas, maybe corona, maybe something else, whatever it is, toxoplasma. These are by far the most common things that we are seeing in our cats. Yeah.
Right, right. Because Mumbai, as you said, Mumbai has different aspects and insight when it comes to cats, and cats are becoming superbly famous
Yeah.
and popular in Bombay,
Yes. Yes.
specifically because of the urbanization. So all these
Yes.
and multiple cat homes are rising. It's not only
Yes.
one cat, so it increases the
Yes.
issue of infectious diseases. Dr. Anisha, what is your insight? In your areas,
In my clinic
other.
also, there is a presentation of most of the time we see the skin problem. Most common fungal infection is very common problem in cats in Jammu.
Okay.
And also
Yeah.
we see a lot of notodris mite mange infestation, and sometimes we see otodectus mite infestation, very, very common. You will find in every cat when you do the otoscopic examination, and you will find a lot of crawling mites inside the ear of the cats. And also we see, like Dr. Amrita said, this upper respiratory tract infection. Herpes and calicium is very common. Even parvo is very common. Feline parvo is very common. When blood, there is a lot of blood in the stool. And when we talk about this protozoal infection, this toxoplasma, most of the time the families where the pregnant ladies are there, we always heard about, like, there's a acquired infection from the cat litter, because that lady is handling the cat litter, and the fetus was dead. Okay, this is the history came from the home of that who's keeping 10 or 11 number of cats at their home, and the pregnant lady is handling the cat. So this is the only platform we can sensitize the cat owners. We can able to sensitize, like, don't handle cat litters or wash your hands regularly, and all the preventive measure you have to follow. If cat owners are listening in this platform, so you have to be very careful. If there is a immunocompromised patient is there at your home, pregnant ladies are there, so these all are the zoonotic infectious diseases which can cause problem to you also. So and also we have seen viral infection is very common, bacterial is very common, and protozoal is also common, and these all are things, and skin problems are randomly the cases are coming for the fungal, bacterial, and mange. These are the common things we presentation in our clinic.
Right, right, right. Professor Tatu, you are the
I,
one who diagnoses and checks a lot of infectious diseases.
yeah.
Testing has been done at Pet Biotech. So, what are your insights on the infectious diseases? Like, maybe you have seen a certain trend in previous years that initially these diseases were more and they have gone down, or vice versa.
No, I think first of all, I think Dr. Amrita and Dr. Anisha very nicely summarized, so wonderfully summarized the most common infections. I've been really amazing that they're on top of what's going on. I just wanted to add heartworm infection. Actually, that's another common thing that we see. Dirofilaria is the causative agent, and that's something that is not uncommon. And we need to really, I think they probably mentioned that, but I just wanted to highlight that. And it's although it's called heartworm, it has nothing to do in that sense to the heart. It's actually causes respiratory distress eventually, but oftentimes showing vomiting and all those things. But that's another infection we must be careful about. But I think the point is that there's so much we know. These are the common infections, and oftentimes there is confusion among them that which one is giving the symptoms. Oftentimes there are multiple infections, as Dr. Amrita had highlighted earlier, and then there's so much that we don't know. Actually, we know only what we have researched and studied so far, and that's really what I want to emphasize. That it's our knowledge is continually growing, and we are beginning. We are, many things we have not tested in the past, and it's only the more we actually study, the more we will understand. But I think for most part, these are the sort of 8 or 10 infections nicely covered, and there's a panel of tests that are offered by many, including our laboratory, which kind of takes care of it. The message that I think I want to leave behind for cat owners and catteries is that uh, get your cat tested by the veterinary doctor, and if required by PCR, to make sure that when you pass on the cat to somebody, it does not have anything. It doesn't carry infection. That's very easy for you to do, and it will be so nice because then you sort of prevent the problem from spreading very much. And if you do find some infection, treat it and then send it across. That will be such a nice practical change that will bring in with the system. Yes, I think that's really where I would like to stop my comment on this, Sagar. Thanks.
Thank you, Professor Tatu. Thank you, Dr. Amrita and Dr. Anisha. Dr. Prati's next question is exclusively for you. We would like to hear from the horse's mouth how important is vaccination. Talked about in detail
Uh,
infectious diseases, and I know you have something to say, so many things to say, but your reaction says it
yeah.
that you can summarize in 5 minutes or 10 minutes. But how important is vaccination?
See, vaccination is the most important, I feel. And just to add to what Dr. Amrita and Dr. Anisha had previously said about the diseases which are common. So even right from my graduation days, these diseases are the same diseases which are still prevalent over here, and we have good vaccines against these diseases. And we have, but the problem what we are facing is maybe uh, the the amount of vaccination which is required is not being practiced now. uh, Globally also what we see is the medicalized rate of cats in India is very very small, so it's less than 10%. It's less than 10%. We have like 11% is of dog medicalized in population in India. It is lesser than that in cats. So we are still have to go very long way with the cat vaccination, at least with the core vaccines, because right now we have core vaccines available, and these are very safe vaccines. We have been using these vaccines for quite some time. They are very very effective, but still we are not very much open to vaccination, maybe for many of the reasons, maybe for awareness, maybe could be something else. But what I wanted to emphasize is the vaccination is the most important thing, what I feel. It not only protects the current pets, it will also help in protecting those animals which are not been vaccinated, because if they have a weakened immunity, and they will also stop the spread of vaccine infection from other, from spreading the infection from other, those weakened population and the young kittens, because kittens right away you cannot vaccinate. So there is a some time where you can start vaccine. So if you have a whole population who is vaccinated, it will at least help this these uh, is it from my side the noise?
No, it's not, I guess.
Okay, sorry. So yes, so for, see, and another thing I wanted to emphasize is basically many of people who think that vaccine is something. Of course, it is. If you ask me, vaccination is the most natural way of protecting the animal, because it uses your own immune system to help you out in developing antibodies, which are natural. We are just helping the immune system to produce the vaccines, produce the protection. So vaccines are basically some weakened organisms. It could be maybe the whole cells, or it could be bacteria, virus, whatever. It actually tricks the immune system in thinking that you are under attack, and then the whole immune system actually takes care of the whole process. They will they will produce antibodies, they will produce T cells, they will retain the copy, they will keep it in the system as a memory cell. And when once you have a real infection coming, your immune system is already ready to fight again. So it gives a very good fighting chance. There are certain diseases where vaccines may not be 100% protective, but at least it will protect you from the repercussions what will have in the long term duration. So uh, it will take it will help the animals to recover faster. It will stop the spread of infection. It will take care of the chronic things what can the disease have. Like for example, in cat flu, there are a lot of long standing symptoms which after the recovery also, after the cats are recovered, so it will at least protect you from those. And like you said, there are a lot of many zoonotic diseases also available. So vaccination also not only protects the pets, it will protect the human beings also. For example, the rabies is the classical example. So uh, what I would have to again re-emphasize it, you should vaccinate each and every cat at least with the core vaccine, and we have all core vaccines in India. We do not have non-core vaccine. So every cat should be vaccinated. Your booster dose should be proper, and you can always discuss with your veterinarians that okay, what could be the risk and benefit. But if you ask me, the benefit always outweighs the risk what we have. It's the marginal risk which are involved with any vaccines. But in the current situation, what we have seen with the current data, what we have seen, we have very, very, very less chances of any reactions also happening. Very less reactions. So ultimately, vaccination is the most important thing what you should give to your cats. Thanks.
You tend to also have the with technical insight in your organization. You also have a marketing role. So how do you see the awareness going up in last few years when it comes to vaccination? So is it being a tremendous thing, which is a good sign to all of us, or you think there is a lot of things to be done?
Yes, I do agree with the maybe what I've seen in the current 2 3 years basically. We have suddenly seen a rise in first is the cat adoption, and another thing of vaccination. So people are getting aware about the preventive care. So earlier, what was the thought process is that if the cat is sick, only then you get it to the clinic to get vaccinated, and maybe the cats which are vaccinated maybe they were more oftenly vaccinated with only rabies. They were not being vaccinated with the core vaccines what they are required to be protected against. But nowadays we are seeing a lot of changes. We are seeing people talking about vaccination. We are seeing not only vaccination, we are talking about the preventive care, even the parasite protection. So there is increased awareness. There are a lot of things being done to create awareness among the the pet owner community, but we are still have to go very long way to actually reach out to that place where we can see, okay, fine, we can manage these diseases, uh, but still, yeah, it's a good thing, but still there is a lot of work to be done.
We are on track, but there is a long way to go.
Yes, yes,
And that has been, one of the key areas for FCI to work on in creating the awareness. We have been always
yes,
keen on vaccinating the cats in our drives, and creating that sort of awareness, as well as in our conventions. Even we have done over 85 offline conventions, like on ground conventions, but we always tend to have this topic of vaccination and deworming, because it's like it has to be hammered again and again. People will do vaccination maybe for the kittens at times, but when they turn adult, so they lose onto the cycles.
you know,
So that is something that's very true. That yeah, awareness is increasing, but there is a long way to go. Thank you, Dr. Pratik, for your excellent insight. Um, I would like to ask a question to Dr. Anisha. That what are the other unique issues that you see in cats? Other than the issues that we are talking about. So, is there something that this issues will only come in cats and not in dogs, or something which is extremely unique, and it has only been oriented towards cats?
Yeah, cat itself is a very unique creature on this earth. Whatever happens with the cat, everything is unique. Like when owner came to my clinic and he said, "I have changed the curtain of my home. I did interior decoration, and what happened to my cat? They went into stress. So stress is like stress-inducing problem is so common in cats, and stress can be of any type. If new member come to your home, new environment, any new guest is coming to your home, so stress inducing problem is very common in cats, and it is very unique in cats. Like we see in idiopathic cystitis kind of problem, like lower urinary tract infection problem because of stress only. So there are huge amount of diseases which is only due to the stress.
Right.
So this is the unique thing, I think, in case of the cats.
Stress
What
and
you
stress. Keep your cats happy is the message. Yeah. But it's not that easy, as you said. A small change in furniture, or maybe a new guest coming in, maybe a new pet in your neighborhood can cause stress in your cats. Maybe you change the cat food or cat litter. It's so easy to get them in stress. So that's an important point. Dr. Amrita, I would like to ask that is there any some genetic or breed specific issues when it comes to infectious diseases? Also, is there some problems which are oriented to breeds? Some breed specific issues, because you are in Bombay and you know that Bombay's cat fancy and cat population may be like 5 years ahead than any other metropolitan. So I would like to specifically ask you this question: that do you see this kind of genetic and breed specific issues in cats? Um, that
Yes, definitely. This is something that's very important to know. I think it's very important when people have, brought certain breed home, that they must read up about it, because there are very specific problems to specific breeds. One very common example, I can give you two very common examples actually, is that there is a predisposition of our Persian cats to a polycystic kidney disease. Okay, it's called PKD. Now, these are little tiny cysts of fluid that build up in the kidney, and they can lie there and cause absolutely no problems until one day when it either becomes too big or something else has affected the kidney, and then it can tip over into a CKD or a urinary compromise. So this is something to be aware of. So we are a little careful when we have Persians who are coming in for even routine surgeries, who are a little bit older, we will, in addition to the blood test, maybe consider doing an ultrasound if we have some cut off some red flags that are specific for cats, for creatinine, etc. If there's anything that is close to that, then we will possibly do a little further check on kidney function, knowing that it is a predisposed breed. The other thing is that we do have what we call flat nosed or punch faced Persians, and these are brachycephalics, and they are a number one, these guys under anesthesia, they're not any less safe. I mean, you can have a problem with any anesthesia and you can have problem with no anesthesia. It's just that certain precautions do need to be taken. Similarly, they are predisposed to more eye problems because their eye coverage is not always 100% with their eyelids. They can be predisposed to respiratory problems because of the structure of their nose and their skull in general. And the last would be, maybe, I mean, it's not very common to see Bengals, I think, but they are predisposed to some blindness issues. They have a progressive retinal atrophy. I think, again, coming back to, if you are doing preventive checks, if you are at home, someone is taking responsibility to look at litter habits, food habits. If you're doing your yearly visits, even if they are not vaccination, your yearly visits to the vet, there is a certain age at which your cat becomes a mature cat and therefore needs it's like when you are 40 and you need a little more care than when you are 20. So don't ignore those visits, do those visits. Your vet is informed about what your cat needs and doesn't need, and do some of those well checks, because the sooner we catch things, the more we can do without stressing the cat. I think home management of ill cats is something that we all want. Us vets want, the cat wants, the pet parents want, and this is only possible when we catch it early. We don't want your cat coming in and staying in the hospital and coming twice a day for fluids. This is not good for anyone. So this would be my take home message here.
Yeah, thank you, ma'am. Because it's also very important for doctors, I feel, that to know the breed of the cats, and that's what
Yes.
FCI does. That will give you breed authentication certificate, and people know, because in our country, every long-haired cat is a Persian, but it could be Sphinx, it could be Norwegian Ferris cat, it could be Maine Coons. So when you talk about Maine Coons, they will have hip dysplasia, elbow dysplasia, and things
Yes,
like that.
correct.
But if
All
doctors
of
know
those.
that this is the breed of the cat, because
Mhm.
see, this is not something which is taught in the curriculum of veterinary
Yes.
science. So, but if they know, because that's the need of the hour, to
Yes.
know the breeds, and cat owners most of the time don't know what they have. But what we do at FCI is, with our ancestral tracking and breed authentication certificates that we have, so doctors have that trigger that this is the breed that is coming in, and they can also look into the breed specific sort of diseases.
Correct.
So that's something I think it's a need of the hour. I think
Yes.
you would agree with me, Dr. Anisha and Dr. Amrita.
Yes, absolutely.
Yeah. And next question to you, Dr. Anisha, is like, what would be the basic mode of transmission when it comes to infectious diseases? How they get transmitted from one cat to another, or to the first cat in your cat group.
Yeah, I have seen personally cat fight is very common.
Okay.
Like any virus or any bacteria can transmit through bites, cat bites. And when you see dog bite is very superficial, but when
Right.
the cat bite, it is very deep, and punctured wound is there. Punctured wound is there, and the main chances is Pasteurella multocida bacteria is there, and it is very dangerous, which causes
Okay.
the further infections, deep infections. So it is very common in cats, and because of cat bite. And second thing I have seen, because of scratch, mostly the kitten, when a small kitten is there, they scratches a lot. So one disease is there, cat scratch disease, which is caused by a bacteria, Bartonella hanseasis, and it is also very dangerous. We have to aware our client that don't, a cat started playing with the owner by scratching their body. So you have to be very careful, because these bacteria can insert in your body, and it causes different, like adenoma and lymph node swelling is there. So we cannot understand, because of cat scratch we are suffering from this disease, so we missed some time. So another thing, through saliva also, the most important disease, that is the rabies. It can transmit to you if your cat is not properly vaccinated with the anti-rabies. Because nowadays also there are so many people have their general concept in their mind that cat do not spread rabies virus, only dog spread rabies virus. Why?
Yeah.
Because they
Yes.
think, because in a report also there is a lot of report in human rabies virus is transmitted through, most of the time we see majority of the human cases of rabies transmitted by the dog rabies virus, not from the cat rabies virus. So cat owners have a tendency, they have a concept like cat do not spread rabies, and my cat don't need like anti-rabies vaccination because my cat never go out, he never come in contact with a stray cat or a stray dog or any wild animal. So how can my cat transmit rabies? So we have to aware the client or pet owners, any warm blooded animals can transmit rabies. Even if a cow can have or can transmit rabies, why cannot a cat? You know, cow is also suffer transmit the rabies. Likewise, any warm blooded can transmit rabies. So through saliva or through bite, through scratches, even through air, there is lot of diseases which transmit through air also. Okay, when there's a lot of gathering or when number of cats are there in the shelter, why so many diseases which is contagious? Why? Because the virus or the spores are present in the air, and the most common example is the fungal infection. Okay, you cannot eradicate spores from the air, and it can easily transmit to you also, and even the other cats can also suffer from these infections. So
Right.
there are number of ways. That's why the disinfectant part is also very important if you are keeping a cat. That's
Exactly. Thank you, ma'am. Dr. Amrita, as Dr. Anisha mentioned that this is significantly ignored thing that cats can spread rabies. How is the level of awareness in Mumbai when it comes to rabies, or doctors are doing their bit by putting rabies shot in their sequence of vaccination, or people are coming up and asking to get the cats get vaccinated against rabies. So how is it the whole scenario?
So the typical thing, it's getting better. It's getting better, Sakib. But
Yeah.
the typical thing, as Dr. Pratik actually mentioned, is we have a very very good compliance when they are kittens. So people will come in and do their first round of shots when they're kittens, and they're very good about it. But later on, once the cat is an adult cat, everyone forgets because they're like, my cat is only at home. It doesn't go anywhere. Where will it get diseases from? So there is no vet visits. I can't put my cat in a carrier. He doesn't like vets, and we don't see the cats again until they're sick. So with rabies, also it is similar. Yes, definitely the cats can transmit rabies through a bite. We usually we also see a lot, especially when they're indoor outdoor cats. It is very very important to get their vaccinations and do their boosters routinely. We are a rabies endemic country, and as Dr. Anisha mentioned, cats can definitely spread rabies. Okay, so I think it is important for us to follow vaccination guidelines in our country to make sure that our cats don't only have the initial rabies vaccines but are also boosted, especially if they have, we other than the fact that they're indoor outdoor, we also have situations where there are so many fosters, people are traveling, they're leaving their cats in a cat shelter, where often they are socializing with other cats. In these situations, it's very very important to have all the vaccinations up to date, because the diseases that we can protect ourselves and our cats from, we must do it 100%, because there are so many that we can't.
Right. So there is one question, Professor Doctor, I would like to ask you is actually.
Sakib, can I add to that actually?
Yes, yes, sir, please.
Yes. So yes. Of course, there is a common
I was
notion
about
that
to ask you, but you left, and I want to
no,
further
no.
expand this.
We are take. The thing is that I'm taking the session from home, and there was a doorbell,
Yeah.
so I had to answer that. And like, anyways, so yeah. Yes, of course, there is a common notion that rabies and dogs go hand in hand, but there are a couple of incidences where we documented incidences I'm talking about where cat have contributed to rabies. I would like to point out two things. One is basically there was a report. There was I think some editorial on the Hindu talking about the incidences of cat related treatment, prophylactic treatment against rabies was highest in Kerala for cats than the dogs. It actually overpassed that. So maybe because when we're talking about cats, it's not only the bite wound what you're talking about. It's also the scratch. So even that is a potential route of transmission of rabies. And second thing, in relation to when we're talking about the scratch, there is a documented case where a 16-year old girl was infected with rabies through a cat scratch, and she was presented with paralytic signs, and eventually she succumbed to the infection. So of course it is not that the cats do not contribute, and it is not that only a bite wound is responsible for transmission. It can, in case of cats, is basically the scratch is also a potential route of transmission of rabies infection. Thanks.
Okay, so thank you. And very quickly, if you can just help our cat owners out with what is a recommended cycle for, it can be the 3-in-1 or rabies, that ideally what one should have in when they're kittens as well as after they turn adult.
Is that the question to me?
Yes, sir.
Okay, about the vaccination, are we talking about?
Vaccination cycle I'm talking about.
Okay, if you're talking about a vaccination cycle, so there are there are a couple of things when we talk about a vaccination. So there would be certain vets recommend a certain protocol of vaccination. The most common would be a 2 or 3 vaccinations process, where it starts from 6 weeks or 8 weeks, depending on how are you starting. So it would be after every 3 weeks, 2 to 3 weeks, till the cat is around 16 to 20 weeks of 16 to 18 weeks of age. That is a recommended protocol, which is also been proposed by Wasawa guideline. Also, even the other American Feline Association, which they also recommend that. Uh, this is because we don't know where exactly the maternal antibody is within the litter. So that is the reason they suggest it should start at 6 weeks of age. Every 2 to 3 weeks, you have to give boosters, and the last vaccination should be around 16 to 18 weeks of age. So depending on when are you starting the vaccination, it could be either a 3-dose schedule or it could be a 4-dose schedule. And annual boosters are supposed to be given annually.
Thank you, Dr. Pratik. And Professor Pato, next question to you is how important, because you get so many tests on regular basis, and then I'm sure you won't be happy to get these PCRs which are positive for FIP and FIV. So how can a cat owner and a vet can jointly help a cat with this periodic health checkups and periodic health checkups that can be contained, and how they can contain, how important are those when it comes to knowing the infectious diseases?
I think it's a very important question, Sakib, you brought up, and we talked about it a little bit. I think recurrent visits to veterinary doctors are essential, especially in case of cats. Even when you don't see an apparent problem, there's no harm in paying a visit to make sure everything is okay, because you really nip the problem in the bud. If there is something at an early stage, of course, if you notice a symptom, even a minor one, then obviously you should go, but you should just make it a habit every 3 months, go and have a veterinary visit. That's something I would strongly recommend. I would strongly recommend the vaccinations that Dr. Pratik and others have. I think that if there is a vaccine available, it's a no-brainer. You got to take it. I mean, you would actually be doing something really wrong if you're not vaccinating your cat. So it's absolutely essential if there's a vaccine available. And there are now lots of new vaccines being researched upon, and scientists and companies like Zoetis are talking even within India. So that's really a boon for us. Finally, as far as the testing is concerned, I think in addition to the veterinary doctor, you should do a kind of a routine preventive test, which tells you that there is no underlying infection which is not yet which hasn't yet actually exhibited present in your animal, because you are keeping the animal with you, you are exposing yourself to the animal as well as possibly other animals. I think it's these are all common practices in the rest of the world, preventive testing and so on, and that's possible. One of the problems we have in our country is not enough avenues to do all of these testing. Often people tell me that, hey, how do we send you blood sample? I'm in this part, like, for example, Dr. Anisha has been trying to send us samples, and we are working out some ways from Jammu. But the good news is that now we have developed a technology where you can put the blood sample on a paper, and we actually supply paper all over the country. And all you have to do is not send the blood, but just a couple of drops of blood on a piece of paper. That's a new technology we are developing and developed. So, Dr. Anisha, I will send you this, and also whoever is interested, of course, also Dr. Amrita. It's going to make everything so much easier. So it just takes a little bit of effort from your side to ensure that your cat is healthy by doing this standard practices that are very common, routine in rest of the world. Why can't we do it? We really need to bring this culture in our country. Thank you, Sakib.
Thank you, all four of you. And this was considerably a very short notice thing that we did this time. And I'm so thankful to all of you that you accepted our invitation wholeheartedly. One more thing that I would like to say, that something that we're doing with ISC and Petbatic very, very shortly is we are trying to formulate a panel that can test around 14 diseases. Okay, so it's a boon, a blessing to the cat owners who are giving away their kittens to new homes, as well as the new people who are getting the kittens from the XYZ cat breed. So they will ensure, both of them, that they are at least assured that these cats were free from all these 14 diseases. Basically, all your organs are working, fantastically. So this is something that one of the services that FCI would like to start under the research unit and scientific and research unit of FCI, which would be headed by Professor Tatu. So this is something that we are trying to do very early, and we would launch it very soon, so that even you can easily go to a vet and draw 2 cc's of blood is all that we need, Professor Tatu, and get the whole panel done.
Absolutely.
So thank you, everybody, and thank you all the cat owners for their patient listening, and thank you again. It was a fantastic session, and the discussion went on a lot of important aspects and untouched arenas for cat owners as well as vets would have learned a lot from this. So thank you all of you.
Thank you, Sakib,
Thanks,
and thank
Sakib.
you all of you.
Thank you very much.